Hello everyone, this is Dr. Mo with Wink Orthodontics. I'll walk you through one of the cases that presented to us at the office and we'll show you how we treatment plan the case. Now, if you ever see me at the clinic, the first thing I look at when someone walks in is I look at their top teeth individually, without looking at the bite, without looking at the bottom teeth. The reason why I do that is because I like to take things one step at a time. And the first thing I look at is the alignment of the teeth. We want to make sure that the teeth are lined up nicely. And this is how we look at the alignment. We draw a straight line through the biting surface of each one of the teeth. And here you can clearly see how the teeth are not in a straight line. If they were, it would look something like this. However, it does not. And that's what we're going to be working on for this case. Now, usually for such a case, I would wait until these baby teeth come out. Yes, these are baby teeth. These are the adult teeth, the premolars. These are the baby teeth, they're molars. And I would also wait until this canine is fully erupted. And same here. If I show you, you can see that they're clearly not in yet. And I'll tell you why I recommended earlier treatment for this person. Usually, if there's a lot of crowding, especially in this area, then this is a high risk for cavities in between the teeth. We want to resolve that ASAP. Otherwise, you don't want, your kid is going to have cavities on the front teeth, and we want to avoid that because fillings will never look as good as natural teeth. That's one reason. The other reason is I want to expand here in the top jaw to help those canines come in properly with the least amount of crowding possible. And the third reason is they have a big overbite, and I want to help them address that ASAP. The sooner the better with these cases, because they might have, self-esteem issues. They might be having, kids are giving them trouble in school, and we want to make it as easy as possible for them. Now, when we look at the bottom teeth, you can see the alignment is not as bad as the top. The teeth are fairly straight. They're not perfect. And again, this is what it would look like if it were. It obviously does not look like that. However, it's not as complicated as the top front teeth. Having said that, let's also count the teeth. And that's an important thing or an important step for every patient, right? And here, 1, 2, 3, 4, and 5. There's a tooth missing, and the tooth missing is actually right over here. So there's meant to be a canine in here, but there isn't. The canine is actually right over here. You can see it trying to come in, but it's going to come on the front side of the teeth. So what we also want to do is expand the bottom teeth, push them out of the way, create a little bit more space for this bottom canine. There's a few different ways for us to treat these cases, and there's no perfect way. It really depends on the preference of the person or the parents and the child. And the easiest way to do this is for us to go through rubber band wear, where they start looking like this. You can see the top teeth are far away from the bottom teeth. There's this big gap. Them wearing the rubber bands full time, 22 hours a day. They can take them off to eat, but even then they don't really have to. After 9 to 12 months of full-time wear, the teeth can look like this in the front if they did a good job. This leaves a lot of responsibility on the patient, and sometimes it works great, and other times when they don't wear it really well, it doesn't work great. And there are alternatives, but really it gets more complicated from here on. And you can see we have a spring. So this is a fixed spring that's on the teeth the whole time. The patient doesn't really have to think about putting it on. But I mean, imagine having this on your cheek side. It will not be fun. You will be feeling it every time you talk, every time you open your mouth. But again, it works great. And you can see it pushes the teeth forward over time. It does the job of rubber bands basically, and you have to have it in there for also like a good 6 to 9 months. I would say 9 to 12 months, so we get a really stable result. And the way it works is by pushing the bottom teeth forward. Now, when we push the bottom teeth forward, we're technically pushing them through the bone. And what that means, and I always tell the parents, whether it's the spring or the rubber bands, there will be some recession, especially if there's a big overbite. I mean, when the overbite is small, not really a concern, but when it's a big overbite like this one here, I mean, that's like 13 millimeters, and we really want to keep it as biologically sound as possible, the treatment. Another thing that I can suggest to patients is, we can do jaw surgery. I don't recommend that to every single patient, but when it's this big, I tell them, when they grow older and they're an adult, we can do jaw surgery where we push the bottom jaw forward, and sometimes we push the top jaw back. And I'll tell you why we do that. Really, the reason why there's this entire overbite here is because the length of the top jaw is a lot more than the length of the bottom jaw. And you can clearly see it right here. You can appreciate the difference here, right? Doing surgery to push this jaw forward is going to help us a lot. But do we want to do that? Obviously, surgery is very intense, and I don't push people to do surgery, but if they want to, then it's great, especially when there's sleep apnea or airway or breathing issues, because that moving the jaw forward will really fix those problems. And then the third option, and some people don't like this, but it's to remove teeth. Removing teeth works, and it works really well when done properly, but it really depends on the person doing the treatment. If someone's doing the treatment right, then it works great. If they aren't professionals or they're not used to doing extraction treatment, then I don't exactly recommend them to do it. It has to be with a very experienced doctor who is able to dedicate time to get the case done properly. At the end of the treatment, no one knows that there was an extraction done. You can see that all gaps are closed and the overbite is fixed, especially when there's severe crowding, like we do have in this case. Another thing that I want to point out is the bottom teeth here go up a fair, and for us to be able to bring them down, that takes a little bit of work, but not just work, but also space. For us to line up those teeth, let me show you. Let's draw a line right on top of those teeth. So if we were to draw a line where the teeth bite, it looks like this. It should not. Drawing a line should come in straight like this. So us bringing those bottom front teeth down, also called intrusion, eats up some space. So we have to create space to intrude those bottom front teeth. We have to create space to to fit this canine that's missing in. And all these things, honestly, what they do is we're going to be pushing these bottom teeth through the bone, pushing them forward, exposing more of the crown and eventually the root of the teeth, causing gum recession. And the way we avoid that is either surgery or extractions. Sometimes, what I tell patients is it's always worth trying wearing the rubber bands because some people respond really well to rubber bands and they get no recession whatsoever. And if that happens, I say, hey, you know what? You don't have to do the extraction. You're not getting any kind of recession. Everything's looking good. And I never push for extractions, but I always say that, hey, if we need to, we can always decide to do that later on, and we never commit to it from day one. So what we're going to do for this patient is we're going to expand the top jaw. This offset any risks involved with extractions. Some people say that they affect the airway. Even though research suggests otherwise, having an expander in there really helps us avoid complications related to that. For the bottom, we would also put in an expander, widen the jaw, bring in this canine, and we would reassess to see if we can continue wearing rubber bands or if the conditions of the roots are too poor. If everything with the roots is fine, we would wear the rubber bands for 9 to 12 months, and during that time we would still be monitoring the roots of those bottom front teeth to see if everything's going well. If yes, then easy peasy, slam dunk. If not, then we would have to look into other options and we would discuss those with the parents. Treatment for these cases usually takes 24 months, whether it's braces or Invisalign, whether it's with the rubber bands or extractions or a spring or even surgery. These cases do take time, to be honest with you. We're excited to help this patient, and we're excited to see how their teeth turn out over the next couple of years. So we'll keep you all posted, and thank you for watching.